Dear media friends, now we are holding the Beijing Pandemic Prevention and Control Conference, the 371st presser. And now we are seeing a rapid increase of the confirmed cases. So here we'd love to give warnings to our civilians. Nucleic acid test is the means of identifying the infection. So please actively participate in the community level or the entity level test timely. And when you are taking the test, please stand in the queue and do not gather with high density of population. Please keep a social distance with others and wash your hands frequently. Before the result of the test comes out, please try to minimize your outings and do not leave Beijing district. And for the countryside and the outskirts of Beijing, please be committed to different containment measures. And as to the outsiders and those coming back or from Beijing, please have a checkup on them. If you have any ceremonies kept on hold, please try to avoid the gathering of population through the ceremonies. And dear civilians, please hold yourself accountable for the containment measures and pay close attention to the updates published by the certain authorities. If you have a close contact, and if you have any abnormalities in your health code, please report. In this round of outbreak, we have found some infected elderly people unvaccinated. So vaccination is an effective means, and vaccination will help you to avoid any severe symptoms and dangerous situations once infected, especially among the elderly people and the children. Please get vaccinated as soon as possible. And if you have already been vaccinated and the period has been about half a year from the last vaccination, please get a booster. We hope that everyone could contribute to the containment. Today's presser has invited Beijing Health Commission Deputy Director, Mr. Li Yang, from Beijing Public Security Bureau, Deputy Director General Pan Xuhong, from Beijing Commercial Bureau, Deputy Director General Zhao Weidong, Chaoyang District Deputy Chief Yang Beibei, from Tongzhou People's Government Deputy Chief Dong Minghui, from Beijing Prevention and Control Office and National Level Expert Panel Lead Pang Xinhuo. They will take your questions. And first of all, let's give the floor to Madam Pang Xinhuo from Beijing CDC branch to give us the report about the adjustment of the risk levels of Beijing districts. Dear media friends, good afternoon. Now, I'd love to share with you about the situations of infections and the health alerts in Beijing. On April the 26th till 27th, the newly confirmed cases were 46 local cases, including 42 confirmed cases and 4 asymptomatic carriers, 12 in Fangshan district, 5 in Tongzhou district, 3 in Fengtai district, 1 in Changping district. And number 231, 234, 244 to 231, 246, 256 are students in Chaoyang district. And they are the close contacts of the number 146 infected person discovered on the 23rd. And their nucleic acid test results were all positive on the 26th, and they were transferred to the designated hospitals. And the number 246 used to be the asymptomatic carriers. As to the 231st, 234, 245, and 248 were confirmed cases. As to the 231st, 234th, 244, and 45 were the mild cases. And the 248th case belonged to the normal cases. Number 261 were confirmed as a positive. As to number 234, 33, 39, 43, 264 to 270, they all live in Chaoyang district. On April 23rd and 24th, as the close context of the number 266 confirmed cases, they were quarantined, and their test results come out on the 26th of April as positive cases, and they were transferred to the designated hospitals. And number 239 used to be asymptomatic carriers. As the number 232 to 233, they were diagnosed as the confirmed cases. 232 is the normal case. 233, 243 are mild cases. On April the 27th, the number 264 was diagnosed as asymptomatic carrier. Number 265 till 270 are confirmed cases. For number 265, 266, they are normal cases clinically. Number 267 till 270, they belong to mild cases clinically. Number 235 is now living in Chaoyang district, Shibali Dian village, Hongshan neighborhood, number 213 building. And in Huguosi restaurant, he was eating there, and he took the test on April the 26th, and the result came out on that same day as positive, and he was already transferred to the designated hospital, and he belonged to the mild case as well clinically. Number 236, 237, 254 are relatives, and they are now living in Balizhuang neighborhood, Hongmiao Beili, number 33 building, and 236, 237 used to eat in Huguosi restaurant on April the 23rd. And on April the 25th, the nucleic acid test result was proved to be positive, and they were transferred to the designated hospitals. And number 236, 237 were confirmed as the infected people and mild cases on the 26th. On April 27th, the number 254 was confirmed as local cases belonging to the usual cases. Number 238, 240 belong to the family members of the confirmed cases. They are now living in Dongtiejiang neighborhood in Fengtai district. 240 is an employee of Huguosi restaurant, and on the 26th, he was put into central quarantine as a close contact, and on the same day, the test result was positive and was transferred to the designated hospital. Number 238 was diagnosed as the confirmed case as a mild case on the same day of the test. For 240, he was diagnosed as an asymptomatic carrier on the same day of the test. For 241, is now living in Doudianzhen Township of Fangshan District. Number 24th building. On April the 19th, he used to visit Doudianzhen in a restaurant. And on the 24th of April, as a close contact, he was put in central quarantine. And on the 25th, the test result was positive and was transferred to the designated hospital. And he was confirmed as a local case, as a mild case on the 26th. For 242, he's now living in Doudianzhen Fangshan district. number 24 building of Shijieming neighborhood. With number 241, they live in the same neighborhood. And on the 24th, as a risky population member, he got the test results. And he's transferred to the designated hospital and was confirmed as the infected person on the 26th of April. For 247, he's the family member of the number 264 confirmed case and share the similar conditions of number 264. For number 140 and 141, they used to be the handyman of this person, newly infected. And on April 26, he was diagnosed as a confirmed case with normal and mild symptoms. For 249, he's now living in Changping District, Dongqiaokou Township, Langecuang Village. On April the 24th, with number 145th, they used to maintain a house together in the same environment. And as a close contact, he was put into central quarantine. And on April the 25th, the nucleic acid test result comes out as a positive case and is now transferred to the designated hospital. And he's confirmed as a mild infected person. For number 250 person, he's the family member of the number 186 infected person. He's now in Changxingdian neighborhood of Fengtai district. As a close contact, he used to take the nucleic acid test, and on the 26th of April, the test results was reported to be positive. And this person is now transferred to the designated hospital, and he belonged to the mild case clinically. For number 251, 253, the infected people are now living in Doudian Township of Fangshan District. On April 21st and 23rd, respectively, they participated in number 220's wedding ceremony. And as close contacts, those two persons took the nucleic acid test, and on April the 26th, the test results were positive and were now transferred to the designated hospital. For number 251, he was diagnosed as a confirmed case on the same day of the test, and on the 27th, number 253 was diagnosed as the positive case. They both belong to mild cases. For number 255, 257 until 259, they used to be the family members of number 241 confirmed case, and the living address is the same as number 241's address, and they used to be kept at home for quarantine. And on April the 26th, the test results were reported to be positive, and on the 27th, they were confirmed as the infected people with mild symptoms. For number 260, 263, their address is now in Tongzhou district as the on-campus students. On the April 25th and 27th, they share similar trajectory with number 237, so they took the test and the results were positive and were now transferred to the hospital. On April the 27th, they were confirmed as the infected people with mild symptoms clinically. For number 262, he's now living in Yangzhuang neighborhood, Xinhualian Jingyuan number 4 building of Tongzhou district. On April the 25th, as one of the risky population, he took the nucleic acid test, and on the 26th, the test result was reported to be positive and was now transferred to the designated hospital. On the 27th of April, he was diagnosed as a confirmed infected with usual symptoms. For 271, he's now living in Yongshun Township, Yudong-yi neighborhood of Tongzhou district. Number 10 building of Jingdinghe North area. He is a teacher in the training organization. On April the 25th, because of fever and cough, he go to the hospital for treatment, and on the 26th, the test result was positive and was now in the designated hospital. And on the 27th, he was diagnosed as a confirmed case with mild symptoms clinically. For number 272, he's now living in Yangzhuang neighborhood, number 299 building of Tongzhou district as an on-campus student. On April the 26th, because of fever, he paid visit to the hospital, and the same day test result was positive and is now in the designated hospital. On the 27th, he was confirmed as the infected with mild symptoms clinically. For number 273, 275, 276, they belong to the family members of number 229. 275 and 276 are now the students on campus, living right now with the same place of 239, and they took the nucleic acid test as these family members and close contacts, and the test results were positive and were diagnosed as a confirmed case on the same day of the test. For 273, 275, they were mild symptoms, and 276 belonged to the ordinary type. 274 is now living in Lingzhuang village of Fangshan district. On the 27th, as one member of the risky population, he took the test, and the result was reported positive and transferred to the designated hospital. And the clinical subtype is mild symptom, and the cumulative confirmed cases is now 138, covering 8 districts. Chaoyang district includes 80 cases, Fangshan 29 cases, Shunyi 8 cases, Tongzhou 6 cases, Fengtai 6 cases, Changping 5 cases, Xicheng 2 cases, Yanqing 2 cases. Today, Tongzhou district has 3 more additional confirmed cases. They are students coming from 3 different middle schools. Fangshan has another 2 students infected coming from middle school and a nursery home for the young children. And among the cumulative confirmed cases, the children and the on-campus students took up 31% of the total, covering 6 schools and 2 nursery homes for the children, mainly concentrating in 1 middle school of Chaoyang district with a reported case of 36. And the campuses usually have a high density of population, and some students may have a traveling history outside of the campus, so that's quite complex, adding more difficulties to the transmission of the virus. Right now, in Beijing, we have a complicated situation of the containment of this virus, so we have to stringently race against the virus and have a quick tracing of the risky population. And according to the development of the virus, as well as the nucleic acid test, we will dynamically readjust our containment measures. The delivery, catering businesses, and the supermarkets and shopping malls must enhance their management of the people dynamically and stringently carry out the health monitoring and nucleic acid test measures. And in the highly populated areas, we must increase the disinfection frequencies to avoid the gathering of population. And we must give alerts to the civilians to pay high attention to your health code and the updates of the city pandemic situation. For those risky population, for example, you have any abnormal health code situation, please report to your neighborhood and execute the containment measures. If you got the notification from the neighborhood, please go to the test station quickly and protect yourselves, contributing your due part to the containment of the virus in Beijing. So that's all I can share. Next, I would love to report the readjustment of the risk level. Until April the 27th, in Fangshan district, Dongdian township, Yuzhuang village, in the last 14 days, accumulative reported cases amount to 10, and with the evaluation of the municipal CDC branch, based on the risk definition requirement starting from today, Dongdian Township, Yuzhuang village of Fangshan district was readjusted to be high risk area from intermediate risk area. Also, by the same time, today, Gaobeidian village Fangjiayuan neighborhood has a cumulative reported case of 10 in the past 14 days. So, Yandu Shijiemingyuan neighborhood of Fangshan district has a cumulative case of 6 in the past 2 weeks. Through the evaluation of the Municipal Disease Control Center, according to the risk level definition requirement, Gaobeidian Village Fangjiayuan neighborhood of Chaoyang district and Doudian Township Yandu Shijiemingyuan of Fangshan district are boosted to be the high-risk area from low-risk area before. By the same time, that is the noon time of today, Songyu Xili of Panjiayuan neighborhood in Chaoyang district and Hongmiao Beili of Balizhuang neighborhood have cumulative cases of 3 respectively in the past 14 days. The Shuangjing neighborhood and Zunhe Village Kangyingjiayuan neighborhood and Xiaogaoshe Village of Doudian Township have reported cases of 2 respectively in the past 14 days. So through the evaluation of the municipal CDC branch, according to the risk level definition criteria, starting from today, Songyu Xili neighborhood of Panjiayuan Street and Hongmiao Beili community, Shuangjing neighborhood Huangmuchang community, and Zunhe Village Kangyingjiayuan number 3 community, and Xiaogaoshe Village of Fangshan district will be elevated to be mid-risk areas from low-risk areas before. Right now, we have 5 high-risk areas in Beijing. They are Songyuli community of Panjiayuan neighborhood, Zhoujiazhuang Zhonglu Street, number 19 building of Shibalidian, Fangjiayuan neighborhood of Gaobeidian, Yuzhuang Village of Doudian Township, Fangshan district, Yandu Shijiemingyuan community, and we contain 16 middle risk areas. Songyu Dongli community from Fatou Street, Fatou Xili community, Yishui Fangyuan community, Nanmofang Village, Nanxingyuan community, from Shibalidian Village, Hongshan Jiayuan, from Shibalidian Village, Zhongjiazhuangli number 20 building, and Guanghe Nanli 2 Street, Fatou Street, Fatou Xili number 3 community, from Panjiayuan Street, Wusheng Dongli, from Nanmofang Xiang, Shuangrong Nanli, from Panjiayuan Street, Songyu Xili community, from Balizhuang Street, Hongmiao Beili community, from Shuangjing Street, Huangmuchang community, from Zunhe Village, Kangyingjiayuan number 3 community, from Fangshan District to Doudian Township, Tianjiayuan Village, and Doudian Village, Xiaogaoshe Village. All the other areas in Beijing belong to the low-risk areas. That's all for my part. Thank you. Thank you, Deputy Director Pang Xinhuo. Now let's give the floor to the Deputy Chief of Chaoyang District, Deputy Mayor of Chaoyang District, Yang Beibei, to brief us. Good afternoon, everyone. Now I'd love to report about the situation in Chaoyang District. By the afternoon today, there are 22 confirmed local cases and 3 asymptomatic carriers. They are relevant people to the confirmed cases and are transferred to designated hospitals. For the 22 confirmed cases, 18 are mild cases and 4 are usual cases. And that's all I can share. As to the details, first of all, there are some new risky points. Number 155 of Dayang Street, Jingsong Street, Heping Village, number 5 building. On April the 21st, 7 o'clock, Kangyingjiayuan, number 24, Xinfadi Supermarket, and from 9:15, Jinkelong Supermarket. From 17:10 to 17:15, Lishanhuang Huawei Xili store, and on the 22nd, from 7:50 to 8:15, Kangyingjiayuan 24 Xinfadi store. From 13:10 to 14:20, Wangjingbei parking lot. And from 14 to 14:30, 国庆院 parking space, nucleic acid test station. On the 24th, 15 p.m., 广渠家园, a restaurant. And at 9:15, 广渠家园number 24 building, 世纪华联 supermarket. 10:15, 嘉里中心 underground B1, 西贡麻辣 restaurant. And at noon, 富力城金牛酱 restaurant. 12:30, 东三环中路number 65, 麻辣香锅 restaurant. From 13:20, 小谷姐姐 hot pot. 13:45 to 13:50, 燕郊烧鸽子和重店 store. 14:15, 建国路原本出色 restaurant. From 14:20 to 25, 建外 SOHO number 7 building, second floor, 三合园桥头排骨 store. Those are the risky points. If you have any shared traveling history with those places, please report to your entity and your neighborhood. Or you can call the CDC branch of Chaoyang District, 8778-9709. 2 cases reported today used to eat in 护国寺 restaurant, 光明店 store. So, at 2 p.m. of 24th of April, if you have paid visit to that restaurant, please report yourself. Secondly, as to the settlement measures with the government leadership, we have set up our panel of professionals so that they will give command and decentralize this detailed work to the frontline level. So our cadres will work shoulder by shoulder with the grassroots level, and we will try to guarantee the orderly management of the nucleic acid test. We will quickly curb the transmission of the virus. We will orderly carry out nucleic acid test for the prioritized areas. If the samples were tested positive, the confirmed test has already come out. 3 are positive, and Chaoyang District quickly and stringently cover their residents. For example, Jinsong neighborhood, Jinsong 819 building, Ducheng Xinyu neighborhood, and Dongsanhuan Zhonglu number 5 building, 45th floor, were put into our temporary management. Today, we have a second round of test. In this round, there will be 1,529 test stations with 28 new stations added. And our civilians could feel free to get the test done. And by 3 o'clock this afternoon, we have completed 3.04 million tests, and we will quickly report the results of the test to enhance our testing capabilities. Our dear civilians, please be reassured if you coordinate with our test, and I would love to thank all of you for your coordination. This morning, there is cold spell, and it's raining right now, but your enthusiasm is not subdued because of such a raining time. And if you are living in the controlled area, do not go voluntarily for the test. You can only go while you are notified by the community to avoid any cross-infection. For the people living in other areas, please go to the test stations in different time segments to avoid a gathering of population. And during the test, please protect yourself with facial masks and be quiet. Do not smoke. Do not gather with others. Do not call people. Keep sanitation of your hands and leave the test station as quickly as possible once it's done. And secondly, we will try to dig deeper to have stringent measures. We have a quick screening process. Right now, we have identified 5,135 close contacts covering people living in and out of Chaoyang districts. According to the latest epidemiological survey and the nucleic acid test results in Panjiayuan neighborhood Songyu Dongli number 9 building, from Panjia Yuan, number 30, 71st buildings, and Wusheng Dongli number 5 building, 18里店 village, 青年公寓, Hongshan Jiayuan 213 building, from Nanmo Fangxiang, number 133 building, 潘家园街道 潘家园 Dongli number 12 building, from Gaobeidian village, Fangjia village, Jinmenggu opposite buildings, 八里庄 neighborhood, 红庙北里 32 building, 六里屯 neighborhood, 晨光家园 224 building, 洪博家园 district 1 number 6 building, and unit 6 from Nanmofang village, number 5 Yujingyuan, and number 2 building belong to the controlled areas, and the people can only receive doorstep services and they cannot step out. From 潘家园街道 Songyü Dongli number 6 building, number 7 building, 潘家园街道 76 building, Nanmo Fangxiang Shuanglo Nanli 122 and 121st and 31st buildings, 八里庄街道 红庙北里 22 building, 24 building, 25 building, 28th building, 29th building, and 30th building, from 六里屯街道 晨光家园 224th building, 小侯门巷 village 洪博家园 number 6 building, 南磨坊乡 village 首图东路 number 5 裕景园 1st building, and from 18里店 village 红善家园 214, 215, 216, first floor commercial residents were the controlled areas right now. And in the next step, based on the epidemiological survey results and the test results, we will further identify the risks and take certain containment measures. Thirdly, for the cages, we will put them to the grassroots level. Grassroots level requires the mass coordination. Is the front line of our battles, and we will decentralize our cages to prep up the front line. The village level and the neighborhood level will work together with all the others, and the party members will also be dispatched to the village level to support the nucleic acid test, and there is a total number of 5,000 such decentralized cages. And we will have 600 other cages to participate in the big data sourcing work. And we also dispatched 300 cages from the government agencies to support the service logistics in the grassroots level. We also advise the unpost party members to serve the communities. And the cages will be the volunteers in the grassroots level. And firstly, we go all out to guarantee people's basic lives. We will try to galvanize resources from different circles to support the lives of people living in the controlled areas. In the surroundings of the controlled areas, we will try to put 320 tons of new things on the shelves, and yesterday we dispatched dedicated vehicles to offer fresh vegetables and fruits to the controlled areas and contained areas. We also have APPs to buy the packages of vegetables and food. For the disabled and other vulnerable groups, we offer individualized services to smooth away the last 100 meters. For the supermarkets, we have dedicated delivery men and drivers with a wide list in place. So we will try to improve the service capacity of the supermarkets. In the contained and controlled areas, we follow closely the situation of the pregnant women, elderly people to meet their medication needs. And we will instantly solicit needs of the civilians to solve their actual problems. We will go all out to serve the people. Right now, the pandemic is in a severe situation, and Chaoyang District will quickly and stringently take scientific and precise measures to implement the containment measures, and we will try to expedite the nucleic acid test, and since it's raining in these days, it's slippery outside on the road. I would love to thank all the civilians for your participation of the test, and to the first-line workers, the volunteers, and the community workers, thank you all for your dedication. Let's fight together against this virus. Thank you, Madam Yang Beibei. Next, let's give the floor to Deputy Mayor of Tongzhou District, Dong Minghui, to brief us about the situation in Tongzhou District. Good afternoon, media friends. Now, let's turn to Tongzhou District. On the 27th, Tongzhou District has a new confirmed case number of 5, all in designated hospitals right now. 4 are marked cases clinically, 1 as usual case. Tongzhou District strictly adhered to the principles of in-depth discovery and stringent containment measures. We will work around the clock to respond to any emergency to avoid the transmission. As to the details, they are as follows. First of all, the basic information. Case number 1, female, living in Tongzhou District. In Mudanyayuan neighborhood. The case is a student on campus.
4月26日报告出筛结果为阳性，经区疾控中心单采复核结果为阳性。3名学生均于4月23日前往通运街道通湖大街78号经贸中心1602B 参加培训。与我市已通报的外区确诊病例，在经贸中心1602B 有同时交集。
老师，你把这个关了用
病例
这个。
4，男，现住通州区永顺镇渝东一街金地格林北区，职业为培训教师。4月23日
On April the 23rd, in Tonghu Street number 78, 经贸中心 16202B, he's receiving training. And then in Youyi Hospital, Tongzhou District, he get the nucleic acid test, and the result was positive on the same day. For case number 5, female living in Yangzhuang Street, Wulidian Xilu Road, Xihuayuan neighborhood, working now in Xiguangda Zhongxin Phase 1, Lavasa Coffee Shop. On the 26th, he participated in a mass test and the result was positive. Second, for the risky places, April 21st, 5 p.m., 通州区北环环穗天天一家 convenience store. April 22nd, 9 p.m., 西南小站杨庄 store. On the 23rd to 26th, 星光大中心 Phase 1, 8B Lavasa Coffee Shop. On the 23rd, 7 a.m. till 10 p.m. of 22nd, 经贸中心 of Tongzhou District. On the 23rd, from 7 a.m. to the 26th of April, 中古大街 number 6 老家肉饼 store. From the 21st, 11 a.m. to the 26th of April, 通湖大街 of Tongzhou District, number 80, 古木酱骨店. April 25th, 4 p.m., 华联 Supermarket, Yangzhuang Store. On April the 26th, 6 a.m., 9 to 11 a.m., 如和医院 Hospital Fever Clinic. On the 26th, 7 a.m., 通湖大街 number 80 building of Tongzhou District, 老北京包子铺 Restaurant. On the 26th, from 8 o'clock to 3 p.m., 友谊 Hospital, Tongzhou District Fever Clinic. On the 25th, 3 p.m., 永顺平安 Pharmaceutical Store. On the 26th, 4 p.m., 永顺镇渝东里街 Street. If you have any traveling overlap with those places, or if you receive any alert on your health code, please go to your village, your entity, and your hotels or your communities to report your situation. Second, for the measures taken, we will continue the epidemiology survey, and we will make use of the big data sourcing and screening,
判定密接307
307 close contacts are found. 492 people shared the trajectory history, and we have already put down the control measures. And 600 test results are negative. The others are awaiting. Second, for the containment measures, for the confirmed cases, their residents, their schools, and their employment workplaces were surveyed. For the buildings they live, we will have a temporary lockdown. The other buildings in the same neighborhood will be put into controlled areas. There are 6 contained areas and 5 controlled areas. Over 10,000 samples were taken. We also take 170 environmental samples. All are negative. Meanwhile, since multiple samples used to have traveled in the surroundings, 东湖大街经贸中心 is now a controlled area. And there are 2 temporary controlled areas, starting from the north of 东湖大街 Street to 朝晖西 Street and 运河东岸, from the south of 裕代路 Road to 芙蓉东路 on the east and 运河东岸 on the west. Those areas may be readjusted based on the evolvement of the situation. Thirdly, the containment on the campuses. We will speed up the treatment of the identified campuses. 453 are the risky population on the campuses, all put in central quarantine, and 350 are transferred. 80 are on the transportation right now. We have completed the mass test covering 6,357 students. 5,536 have the results coming out. We have initially identified 52 students once visited the risky areas, and their schools will be putting stringent control. Starting from April the 27th, middle schools, kindergartens, the occupational schools will turn to online schooling in the whole district. And adhering to the principles of healthy study, online schooling and Q&A with teachers will be the main means of education. There will be customized educational plans. That design will help us to support the comprehensive development of the students. We will give play to the shared roles of parenting and schooling. Through follow-up visits, online meetings with the parents, and online courses, we will guide the parents to urge the students to study and study at homes. And also, we will have some counseling for the students and faculties. We will enhance our management of the extracurricular training. They were suspended, and we will crack down upon illegal training. And we also send letters to the parents so that they can help to arrange their children's lives scientifically and do not participate in extracurricular activities. And fourthly, we will orderly organize the nucleic acid test. Right now, our district has completed a sampling 1.31 million people. For the samples of 3 people in 1-2, we are now screening the positive results. In the future, Tongzhou District will continue the screening. We will optimize the site selection of the stations and organize the community volunteers to galvanize the population. And for the vulnerable groups, we will have a green channel of the test. We will keep a distance between the test takers. And fifthly, we will stabilize the prices on the market. We will have coordinated regulation and distribution of resources. We have a point-to-point replenishment of the resources, and there will be daily reports. We will lead the different supermarkets, the retail stores to increase their procurement for the daily necessities like meat and flour and rice. We will guarantee adequate supplies and stable prices. That's all I would love to report. Thank you, Deputy Mayor Dong Minghui. Next, let's give the floor to Deputy Director of Municipal Health Commission, spokesperson Li Ang, to brief us about the screening. Dear media friends, good afternoon. Right now, the pandemic is threatening to us, and to further have efficient screening to dispel any potential risky points and avoid the further dissemination of the virus. In accordance with the leading group's arrangement from the 25th till 30th, in the plain area, in Pingyuan area, we have 3 rounds of test results. The first round has been completed with a total sampling of 19.81 million. 19.8 million have come out the results. In Chaoyang District, the temporary controlled areas has 5 tubes of positive cases, and in the society there are 9 tubes of positive cases. In Tongzhou District, have 2 tubes of positive cases. In Fengtai District, 2 tubes as well. In Haidian, Shunyi, Daxing, Shijingshan, there is 1 confirmed case in the 1 tube, respectively. And the epidemiological survey is going on as well. To cut off the transmission of the virus, these measures have played a big role. And in this round of sample taking, we have employed 35,000 professionals and over 100,000 supplementary workers. Our civilians have been looking at the big picture to coordinate with our test, and some of them have given us reasonable suggestions. For the medics, they have been working around the clock to fight against the virus. They have paid tiresome efforts. So, to the first-line workers and medics, sincere thanks to you all. Today in Dongcheng District, Xicheng District, Chaoyang District, a second round of regional-level nucleic acid test is going on. The other areas will continue the test as well. We will try to dispatch more resources to smooth away the sample taking for civilians, so that they will take the test in a short distance and in a convenient manner. Please follow the guidance of your neighborhood and go to the designated stations to have your samples taken in a designated time. Please execute the containment measures and protect yourself while you are lining in queue, and please wear your facial masks to minimize the infection risk and contribute to the city's pandemic prevention and control with your due contribution. Thank you. Thank you, Mr. Liang. Next, let's give the floor to Deputy Director General of Beijing Municipal Public Security Bureau, Han Xuhong, to brief us about the criminal cases. Dear media friends, good afternoon. Containment of the virus is the responsibility of everyone. The capital city of Beijing is in a critical situation, and the whole city has been on vigilance. But still, some individuals turn a blind eye on the laws and regulations, leading to the further transmission of the virus. So, Beijing Public Security Bureau crack down upon the pandemic-related crimes legally. Since the 22nd of April, we have received 40 filings. Right now, we have detained 4 people, and 48 are now put in custody administratively. And there are several cases of them. For example, they do not coordinate with the tracing and give false information about the traveling history. Male, Mr. Jiang, 26 years old, is a confirmed case. On April the 25th, in the epidemiological survey, he intentionally keep his traveling history as a secret on the 23rd. Certain people are not putting the controlled area because of the false information, leading to further dissemination of the virus. As has been confirmed, on the 23rd, Mr. Jiang has paid visit to a training school in Tongzhou district. He's the teacher of the training school, and his traveling history covers the surrounding supermarkets and buses and the students that coincide with his presence. 5 faculties in that training school have a positive result of their samples, and 400 close contacts are contained right now, covering 8 neighborhoods, and 6,700 people are now put in controlled areas. In the other epidemiology survey, Mr. Yan, Yan, 64 years old, and another male aged at 60 also keep their traveling history as secrets, and we have filed cases against them criminally. And second situation is some people illegally gathered students for offline training. A 20-year-old Mr. Yang, since early April, in Jingmao Zhongxin of Tongzhou district, he illegally organized several faculties to have offline training, during which time Mr. Wang was the responsible person, and he didn't work with the health code scanning or temperature taking or disinfection requirements. 5 people have positive test results in the training school, and Mr. Wang has been inspected right now. In the number 315 presser, from the 26th to the 30th, it was stated to suspend all offline training courses on the presser, asking the civilians and the training organizations to coordinate to avoid any transmission through the gathering of population. Thirdly, to disseminate the rumors about the pandemic, causing panic among the masses. Female, a 33-year-old, Ms. Zhang, made rumors about the lockdown of Beijing city. On April the 25th, on her WeChat Moments, she further disseminated the information about Beijing lockdown starting from April the 28th, causing disruptions to our work. A 48-year-old male, Mr. Wang, also disseminated rumors about Beijing lockdown, leading to vicious rumors, and these people have been detained. Also, the netizens complain that there are rumors about paying for canceling of the abnormalities in the health code. Beijing Public Security Bureau pays high attention to the rumors and has started the inspection already. Any illegal behavior will be gotten straight and cracked down upon. Fourthly, do not execute the containment measures and insist on going out, leading to the transmission. Mr. Liu, 41 years old, knowing that his residence belongs to the controlled areas, but he insisted on driving out on the 26th, visiting Tongzhou, Daxing to shop, and he videotaped and then shared the videos on WeChat Moments to show himself off, leading to negative effects and Mr. Liu is already put into custody. Since the pandemic is very complicated, at this moment, we need to conquer the difficulties by working together. Based on the past 2 years of experience, your coordination and support and understanding will be paramount for conquering the virus. We hope that you will continue to conform to the laws and regulations and pay attention timely to the official information and hold yourself accountable for pandemic prevention and control. We will try to work together to protect our home safely. Thank you, Mr. Pan Xuhong, for the information. Next, let's give the floor to Mr. Zhao Weidong from the Beijing Municipal Commercial Bureau to inform us about the supply guarantee. Good afternoon, dear media friends. Now, about the necessity supplies in Beijing, as has been observed in Dayang Lu Road, 7 Tier 1 supermarkets have 27,300 tons of vegetables on their shelves. The price has been taken down by 25%. 8 supermarkets of Jinkelong have a decrease of 20.7% of their prices. The average retail price is 8.74 RMB. For 7 Tier 1 wholesale markets, the pork price shot down by 21%. The wholesale price averaged at 21 RMB yuan, a monthly decrease of 23%. In 7 Tier 1 wholesale price, the eggs was 410,000 kilograms, with a wholesale price decrease monthly. For the retail price, it's 13.48 RMB. In 8 franchised supermarkets, rice, flour sales were 220,000 kilograms, respectively, with a monthly decrease of 47.8% and 51.8%. The retail prices were 5.72 and 4.5 RMB yuan, respectively, per kilogram. And if we look at the whole city, we have abundant supply of the necessities, and the prices are shooting down in a steady manner. And if we look at the wholesale prices, we are also seeing a decrease in Xinfadi. Starting from April the 27th, Xinfadi has 25,805 kilograms of vegetables, increasing comparatively. To meet the demand, the storage of eggs are pushed into the retail level. The key is about replenishment. At the rush hours, we will increase the replenishment. For different categories, there might be different frequencies of replenishment. Today, to different franchise supermarkets, they have standardized the prices, and we are calling upon the enterprises to contribute to social responsibilities in order to keep steady the prices of daily necessities. As to the e-commerce platform, the e-commerce platforms must upload 3 to 5 times more of supplies compared to usual days. There are some packages of vegetables being sold. As to the production efficiency and distribution efficiency, we have worked on it. The e-commerce enterprises have replenished the mostly needed products. Every day, they dispatch 800 vehicles for the replenishment to ensure adequate warehousing of the food And for better containment, the e-commerce services must be boosted. We will optimize the workflow and increase the capacity of the distribution and transportation. We hope to better serve the needs of the civilians. For the controlled areas, we will meet the need of their life necessities. In the morning of the 27th, in Chaoyang District and Tongzhou District, we dispatched 6 emergency vehicles for the distribution of vegetables, fruits, flour, and the seasonings. The average price of vegetables is usually 10% lower than the markets in the surroundings, receiving good comments from the civilians. And according to the controlled areas in Chaoyang District, because of the supply guarantee, many enterprises are responding actively, so the prices are quite steady. The e-commerce platforms must also boost their capacity of transportation. We have already organized some professionals to guide the enterprises in their guarantee of supplies. By increasing the input and guaranteeing safety, we will pivot towards the controlled areas and contained areas. The first-line delivery men have been increased by 1,000. By increasing the delivery capacity and pivoting towards the controlled areas, we can ensure a timely delivery of those life necessities. Thank you, Mr. Zhao Weidong. Now let's open the floor to the Q&A. From CMG, my question is to Liang. According to our knowledge, some hospitals have suspended their outpatient services. So, in the pandemic situation, how can we meet the medical need of the patients? To meet the need of the patients, especially the patients suffering from a tumor, we will do better service work to meet their medical needs. You just now mentioned about the suspension of services in Chinese Academy of Medical Sciences. Since the outbreak of the virus on April the 22nd, actually, the Academy has been working on as usual. To avoid cross-infection, the official account of CEMS advised the non-emergency patients to be transferred to the other hospitals, but the services are not totally suspended. So the hospital puts people first. They optimize the procedure and the mechanisms and the plans. They offer green channels to avoid cross-infection. First of all, they improved their appointment services. For all hospitals above Tier 2 level, they have different time segments for the appointment. They divert the patients to ensure that the patients could orderly appoint the doctors. Secondly, smooth away the channel of treatment for the severe patients. For the operational rooms, the wards, they will be used for the severe patients. And if there is any abnormality in their health code, without the nucleic acid test result, or if there is a delay of the test result coming out, we will try to treat them. Third, medical service guarantee. By adhering to the containment measures, we are improving the contingency plans by detailizing the guarantee measures. We will prioritize our medical services to the tumor patients the renal patients, pregnant women, and in the future, we will urge different medical institutions to execute their work to ensure the oncology patients and some special groups treatment and ensure their basic health. Next question. From Labor Daily. Many places in Chaoyang District are controlled. How to ensure the lives of pregnant women, the disabled, and the elderly living alone? The above-mentioned groups of people are the priority of our containment measures. They have special needs, so we will have classified measures and services so that even in isolation, we feel for them. First of all, we will have an early screening to have a full knowledge about their needs and pursuits. Once the neighborhood is contained, we will send a letter to the residents. There might be several letters coming, and we will inform them about the hotlines of the community services so that they could come to us once they need us. Meanwhile, in the villages and the townships, we will also try to establish some WeChat groups to help us have more knowledge and close contact. We also assign our community workers and cagers to go to the buildings. They knock the doors of the civilians so as to register the needs of the special groups. Secondly, we also organize the medical teams to meet their medical needs. For example, if they are seeking dialysis or the physical examination of the pregnant women, we will try to escort them. And we will also have green channels. The medical team will be on the call 24/7. In the temporary controlled areas, we will streamline the treatment process. For the people in need of seeking medical help, we will ensure the material supplies. For people who do not feel convenient to buy online, they can come to the communities by raising their procurement needs, and the workers will help the procurement and delivery. Also, for the elderly and the disabled, we offer customized services. For those with inaccessibility problems, we will send the food to their doorsteps to solve the last 100-meter problem. So please be reassured, we will take good care of the special groups in the controlled areas. Thank you. This is the end of the Q&A session. I'd love to thank all the experts and leaders and all the media friends. This is the end of today's presser. Thank you.